Good morning, good afternoon. Hello, everyone. Thank you for joining us. My name is Lola Adedogan, and I'm the Executive Director of the Aspen Global Innovators Group and co-chair of the Aspen Forum on Women and Girls. Thank you for joining us for this special panel to commemorate Women's History Month and the future of women's leadership in global health. We are so excited to welcome Dr. Agnes Beniguajo and Dr. Lisa Hirschhorn, two global health scientists and policy influencers. We celebrate their steadfast leadership and resilience, particularly in advancing women's leadership in the global health and research agendas. Today, I'll ask them to share their wisdom as we envision a post-pandemic world where gender equity and gender justice is embedded in all of the decisions that will inform the new normal. We will be taking questions through the Q&A chat function, so please feel free to ask questions through that function throughout the course of the conversation today. Let's get started. Today, women account for 70% of the health and social care workforce and deliver care to around 5 billion people. Yet, only 25% of senior leadership positions are held by women, and even less for those whose gender identity is not male. Research shows that this inequity in global health leadership negatively affects health outcomes for women and children worldwide. Women and non-male identifying people account for less than 30% of global science researchers, with representation even lower for people of color. And they continue to publish less than their male counterparts. The COVID-19 pandemic has underscored how important women's contributions are to science. In fact, women are on the front lines of pandemic response and prevention. Women like Dr. Ngozi Okonjo-Iweala, the former chair of the Gavi Alliance, played a central role in advancing vaccine equity through the design of the COVAX facility. Dr. Soumya Swaminathan is the first female chief scientist of the World Health Organization. Dr. Matsushiro Moeti, the first woman to be elected as the WHO Regional Director for Africa in 2015, and she has since then coordinated emergency responses to health crises in 47 of the continent's 54 countries. And Dr. Kizzmekia S. Corbett, who played an instrumental role in the research leading to the development of the Moderna COVID-19 vaccine. Despite this gender-specific challenges to career advancement persist, including work-life balance, the lack of high-quality and accessible childcare, gender discrimination, sexual harassment, and assault. These are all systemic barriers that persist in all stages of women's careers. The optimists and privileged amongst us have been alluding to the new normal, the world post-pandemic. While we've observed substantial increased recruitment and demand for women across many sectors over the last 2 years, what has garnered less attention and focus is addressing the structural and systemic barriers within systems and institutions, policies, and programs that disproportionately affect women as they pursue leadership roles at decision-making tables. It's my pleasure to welcome Dr. Agnes Beniguajo and Dr. Lisa Hirschhorn, two exemplars in global health, to share key challenges, opportunities, and best practices on the road to achieving gender equity beyond representation in global health leadership. We'll have a brief conversation followed by a Q&A session. And for those in the audience, please feel free to place your question in the chat throughout the conversation, and we'll cover as much as we can. Welcome to you both, and thank you for taking the time to join us. If you wouldn't mind, would you briefly share your route to leadership and some of the gender-based challenges you've faced or you've observed in pursuing your research careers or those of your colleagues? We'll start first with Dr. Beniguajo.
Thank you, Lola, first of all, for having me and to let me join this great and important discussion. So for my career, in 1996, 2 years after the 1994 genocide against the Tutsi that claimed over 1 million lives, I came back to Rwanda, my home country, after 37 years of being a refugee. The health system was destroyed and the morale and accountability among health workers were low. As a pediatrician, I had patients, small children suffering and dying from preventable diseases and their families suffering from this loss. I wanted to create the needed environment to exercise the good clinical skills I have gained during my clinical education in Europe, where I grew up since I was 3 years old. So children were dying from curable disease because we lacked equipment, medicine, diagnostic tests, vaccine, and also well-trained professionals. Facing this situation, it pushed me to advocate for social justice, for better access to health tools and quality services for the vulnerable, but also to walk the talk and contribute to creating an environment for this to happen. So since 1996, upon my return to Rwanda, I contributed to create and improve teaching environment through global advocacy and fundraising, and had to learn to work with other sectors, something I didn't know. I was a simple pediatrician in Europe, but here I had to create a portion of the condition where I was working. So now it is easier because we have studied the social determinant of health, but at that time, working in a destroyed health sector, we had to learn as we were working and create all those concepts as we were trying to build. And after 5 years of working as a physician and doing advocacy for better access to quality care nationally, regionally, and globally, the leadership of Rwanda removed me out of full-time direct clinical services into health sector management as a Executive Secretary of the National AIDS Control Commission, and after that as Permanent Secretary, and after as Minister. I was lucky to not face too much gender bias and gender challenge in my country. Due to gender equity supportive policies, and as you know, we have 61% of the seats in Rwandan parliament that are occupied by women currently, the best in the world. However, I faced a gender challenge and I decided to discourage those concerned by doing that, by always responding in a way that exposed them publicly, make it for them very hard to face the public where we are when it happened, or when it was in private, when we come back in public. So it has discouraged them to try. And what I did also, when I knew stories for other women, I was doing the same. My contribution were initially globally disregarded because I was a woman and I was a Black woman coming from a country that people know only because of the genocide. And for this, I did the same. I scream when it's needed. I sing when it's needed. I celebrate when it's needed. But I want people to know that if they want to fight for equity, they will find me in their way.
Thank you for your leadership. Over to you, Lisa.
Oh, I had a much more, I think, sort of traditional trajectory, and just want to first of all, thank you for inviting me, and both to be with both my peers and my mentors who have really, continued to push me along the way. And Agnes and I sort of laugh because she's taught me to speak up more so than I think anybody has ever before, not surprisingly. So I actually originally started my career in medicine, a much more traditional pathway, which was to go into bench research, but happened to graduate from university and start medical school right as HIV hit, and was in New York City. And so really took a different pathway that was based much more on sort of an unmet need. Both during my medical school and then continuing on through my residency. And I ended up as an HIV physician, actually working in the community as opposed to a bench researcher. And as I say, one of the more inspiring things said to me by my male mentor, which was, why would you want to go work with those people and you'll never get another grant? Because I had actually turned back an NIH grant to go and work in the community. And I think for me, perhaps some of the largest challenges was that there were really no role models. So I had young children, was trying to balance a clinical career, but still very committed to research as a way of addressing the gaps that I was seeing nearly 2 miles away from the Harvard academic institution that I was attending in, and then the community health center. So that was sort of one of the challenges. The second challenge was constantly being mistaken for a member of the team as opposed to the leader of the team, whether I was walking into a patient's room, whether I was working in it. And the only place that didn't happen was in the community health center. And so I think it was really learning how to find a voice when that was not really something that was acknowledged, learning how to even do things like what was the uniform that I should be wearing in the sense of how I dressed. To be able to sort of exude the kind of authority that I don't think people should have to do. People may remember some really awful, I'm old enough to sort of remember the things where women were wearing ties or other types of things to establish themselves as leaders. And I think, for me, that was really important lesson as I thought to sort of turn back and look as I'm mentoring future. And I would say that the biggest support that I had was not actually therefore from mentors that existed, but from my peers and the recognition of the absolutely critical importance of the network of women. And I don't remember who it was who actually said this, but this came up in the in some of the hearings that we're having right now for our new Supreme Court Justice, who will be the first woman of color, African-American woman to sit on the court, that there's a special place in hell for women who don't look out for other women. So I think for me, it was a bit of an exploration as I went forward. It taught me a lot. And it also taught me absolutely the value of the peer network, such as you and yes, who continue to show me the way forward to become both a leader and also help the next group. I also want to point out, and I know we're going to talk about this a lot more, and yes, don't laugh, because as an implementation scientist, I always think about the context and thinking about from Rwanda, the policies that were in place and the culture that was in place so that it would be really encouraging and not unusual for women, but instead expected of women to become leaders is something that we really need to think about. How does this change, not just at the individual level, but also at the organizational and at the system level?
Thank you, Lisa. And I can't reinforce one as admirers of both of you, that you are physician scientists, policy influencers, and staunch advocates of women leaders. And on top of that, you do your best to hold our male allies to account and to bring them into the fold. And so I want to make sure that in this conversation, we highlight some of the key activities beyond policies that can ensure that women coming up through the pipeline who want to be physician scientists, researchers, policymakers, that they are supported. What are the tools? What are the actual actions that you've taken to ensure that your institutions actually adopt some of these practices? Whoever's interested in taking this on.
I'm happy to start. And I think one of the things is that we have to start earlier. So I have the absolute honor and privilege of working mostly with medical students, occasionally with undergraduates, and then a lot with sort of junior faculty and emerging researchers in a number of different countries. But I'm not the person who is really potentially the most critical about working what's happening at the elementary school, what's happening at the K through 12 or the equivalent thereof. How do we make sure that women, when they hit that they are able to get to those opportunities and that they're able to then pursue them and have the voice? And I think that that's a really important thing, so that we're not just looking at our own institutions, but at a broader theme. And that's where I think having the allies is absolutely critical, because whether your teacher is male or female, make sure that that person also recognizes the sort of traditional approaches that women have. It's why we see young girls moving away from STEM education, for example, because they're discouraged. It's not something that young women should do. Teaching them how to voice themselves, giving them leadership positions, whether it's on the sports field, whether it's in the classroom, et cetera. So I think that's a very important thing. And then I think thinking how we really support women, and I think COVID has really shown this. A lot of men really were tremendous allies, and really sharing the burden of, for example, women who had children or had other things to try to balance that. But it actually did fall more on the women. And so figuring out how can we get institutions to understand how to support that, how to create the kind of flexibility that was needed for them, and how to encourage them to continue to move forward despite and through some of those adversities, I think is going to be absolutely critical. I think thinking about how we value impact, and I always sort of think about you, Agnes, when I talk about that, about what's the right impact factor. Is it actually the journal to which you submit it, or is it the influence that your research actually has? How do we actually value as women need to continue along their research careers? And I'm a little sort of biased because I'm sort of talking about research careers, so that they get credit for the mentoring that they are doing, for some of the community activities that they are doing, that those are valued as much as the R01 grant. And how do we really not just value that, but also amplify that as well. So I think we need to change a little bit about what we think is important. I think we need to, in the same way that we do community engagement, we need to engage with that community and hear from them. Where's the support that they need to continue to emerge and develop as leaders? And once they hit that, we need to make sure that they are all of a sudden not always the person on 5 different committees because they are the woman, and particularly for women of color, that they are not the only person who should be doing any of the diversity work, any of the representation work, so that they are able to continue to balance their research interests, their influence, their mentoring, and also if they have a family, how do they continue to do that as well?
I can't agree more, Lisa, and I'm just going to give some examples. So we are women, so we are part of a family, a community, a nation, and we have responsibilities at all those levels. And I'm going and we can do more, far more. We don't do enough. And we, at all places where we are, we need to make the men accountable, but also the women accountable. There are so many best enemies that are women. First of all, because they sustain the system that is gender inequitable, and also and they don't support other women to come up, because that's the only way to increase the number of women that are in leadership position or have the chance to do and to fulfill the dream they had. So I'm going to talk about what we are doing now at the University of Global Health Equity that I co-founded in 2019. We have, by rules, 70% of the enrollment in medicine that has to be women. And it's not easy, because even the best ones say, but this is not equity. I said, this is equity. And it is the difference between equity and equality. 50-50 is equality. And to reach equity one day, today we need to be inequitable. We need to do more for women than we do for boys. We would love to have everybody, but we need 70% of girls in medicine and only 30% of boys. And every year it's a discussion, and I say there is no way. We need to proactively promote women in position, just because girls, as Lisa said, it's the discrimination starts in primary school, continue at secondary school, at university. Every time you lose girls and women in the pipeline. In other courses, it's 50-50. Minimum. And don't tell me that we take the best. So that means the best have the first places, because in my continent, at least, boys have better chance to be better educated than girls. So we'll always be on the bottom. No, we have 100 places. We take 50 men, 50 women. The 50 best girls, the 50 best boys. And I don't care that the girls are even below 100 boys. So this is a choice, and they are all competent. We don't take people who are not competent. That's something to highlight. So and we do that just because there is not enough doctors female in Africa. only 37%. So if we want to recreate the balance, we need to do that by positive, what we call positive discrimination. Many people doesn't like that. But in Rwanda, we reached that level where we are today because the government applied that. Meaning if in 2000, I was competing with a man for the same position, and let's say he had 85% and me 80, I was taken. Up to 30% balance. And if we don't go that way, we will never have a chance to recreate the balance, because there is cultural bias, there is societal factors that are challenges for girls to pursue science, to pursue a research career, because they have to be at home. And COVID has shown that because men and women were at home. However, women were doing more domestic work than men, so they publish less, as you have said, Lola, in the beginning. So the best practice is to radically change systematically what we do when gender is concerned. And also what we have done, we have a Center of Gender Equity that do regularly an audit of our practice, our curricula, our regulations, to make sure that we promote gender equity in our facts.
Thank you for that. And I can't highlight enough a point that both of you have made, is that we have experienced a major setback due to COVID-19. And so, you know, there should be no fear about overrepresentation. In fact, we have to do more now to make up for progress that was had prior to the pandemic. And so, yes, there may at a point look like there are more women, but the data shows that the more women, the better outcomes, in fact. So what is the fear? And what is the concern about overrepresentation when we need it so much at this moment? So thank you both for raising that. And I'll go to one other question. It speaks to also to the moment where we are, for the privileged amongst us, working remotely, and for those who are being educated remotely or doing their clinical science, their research remotely or from home. They still require mentoring and coaching. But mentoring and coaching in a virtual environment is no easy feat, especially for reaching women of color who are, access barriers, it exists to disabling them from engaging in this sort of virtual environment. Can you talk a little bit about ways that you may have adapted or changed your mentoring practice, given your experience in this moment, and maybe ways in which we may apply some of those learnings around mentoring at a distance as we go forward, given that this is part of the new normal, engaging digitally and virtually?
And yes, I'm going to turn to you first, and then I'll follow.
So I think there is nothing better than the face-to-face. First of all, because we all know that the percentage of the dialogue through body language is far bigger than the meaning of the words we use. So, however, we had to do things virtually. And when you do things virtually, to understand that somebody has a problem, you need to have other proxy or inflate other proxy, like what we did when we did the first 6 months of education at home for the medical education. We follow very closely the work that the students were producing, more for girls than for boys. Why? Because she's at home, she spontaneously will serve the family as the girl of the house. And also the family will turn on her more. And what I did when I suspected that problem, I discussed on phone with the student. And if it's true, I call the parents and explain to them that if she was a boy, she will have 2 or 3 hours more to study. And because the competition will not look at her gender, she will lose. And at the end of the day, because they don't let her take the time for study, they will handicap her future, her dream to be a doctor. So you need to adapt, and it's change as we go. We don't know what tomorrow will be. So we need to be open and try to find the challenges and a new way to evaluate those challenges. But because we have so much experience, we know what the risks are. Yeah. So this is just an example of how we have adapted, but there are many others.
Yes, I want to also just echo what Agnès says, which is there's nothing quite like being face-to-face in terms of, when tension arises and you're not sure, is it a disagreement or just a miscommunication? And that's so much easier to do when you're in person. I've had an interesting experience in that probably about half of my mentoring has been pre-COVID, or as somebody called it, the before era, was face-to-face. And actually a growing amount of it was virtual to begin with, because I mentor young women from a number of other countries. And as Agnès knows, my ability to say no is actually probably one of my weakest challenges. So I think regardless of that, it's really important to sort of first recognize, as you're moving into this or as you're transitioning, what are the expectations? What are your expectations as a mentor? What are their expectations as a mentee in terms of communication, frequency, finding that time? I think I've perhaps put even more emphasis on really sort of helping these women sort of learn a couple of things which I was never taught and have had to learn and learn, particularly I have to say from Agnès among other people, which is to learn how to say no. And that's both within the context of their family, in the context of other things that people are asking you to do, to be able to sort of, it's not a selfish thing, it's really is something about self-care. Similarly, to learn how to say, I need help. And that's a very, very difficult thing for the women that have sort of emerged and are these emerging leaders, because there's this feeling that if I say I need help, that's a sign of weakness, and therefore that will actually do that. And to figure out where is that safe space where they can talk to, and that hopefully I as a mentor can be a part of a safe space to say, you can say I need help. And then I think the third thing is to teach them how to problem solve. And often that's where I'm at a disadvantage, particularly when it's virtual. And I don't know the setting in which they are in, whether it's in the US or otherwise. What are those other demands on their time? What are the other stresses in their family, whether it's death, whether it's economic hardship, that are really impacting their ability to continue to move forward, but to at least sort of coach them through how to sort of do this. And then finally, and I think this is often challenging because all of us are under tremendous stress. And I'm sort of looking at in the chat for what Judith had written down, which is this concept of compassion. And that we as mentors also need to be compassionate to what is happening and what are the stresses. I have for example, a PhD student who, unless she had told me, I would never have known that she was pregnant. And then she was 8 months pregnant and when she was going to be due. But she had the ability to say to me, here's what I need. But when you're talking to somebody and you only see them from the top up, you have no idea what else is going on in their life. So I think it's also learning how to gently probe without being intrusive for people to sort of say to you, where is it that they need help? What are some of these other stresses that are happening? But also helping them keep their eye on the prize. What is their goal? And as Agnès had said, what is it that they need to do to continue to be the doctor, to move on their way to become the doctor or the researcher? And what is it that we as mentors need to either help them with, or again, as we've talked about this concept of the network, link them with somebody else who can actually help them in terms of addressing some of these challenges.
Thank you both. And a thought that occurred to me as you were both speaking is what we're speaking to as well as empathy and embedding empathy in our practice. And this moment has also raised that as a muscle, especially in clinical practice, but just in the way that we interact as humans with one another, as we all try to find our way back or our way forward. And so I can't reinforce again in that point around this about this asset that exists in place that needs to continue around empathy-based leadership. So thank you for surfacing that in your responses. So let me transition a little bit in my enthusiasm about what the future holds for all of us. We are at a moment of great momentum for advocating for and including women and non-male identifying people in our work. This goes beyond issues of fairness, ethics, and representation. We know that our world will actually be better off with women in labs, clinics, and clinical trials. The pandemic has also made clear that there's a need for consistent and clear gender lens in the trialing, testing, and allocation of new vaccines and new drugs. And I'm proud to see that many institutions have risen to the occasion, the call of the moment, to advocate for and be more inclusive of non-male identifying individuals, and also to change their policies and practices around recruitment. And we've seen the numbers actually change. So there is there's more representation. And this is exciting, but as we do, we forget. And so it's unlikely that this energy and commitment will last forever. So first I'll turn to you, Agnes. How do we maintain this momentum and increase focus on the recruitment and inclusion of women in the research and policy environment? And then as you respond, Lisa, what data do we need? What information do we need to ensure that we are able to hold all of the parties at play to account?
Thank you, Lola. So it's a very interesting question. But first, we need to acknowledge that COVID-19 has rolled back women scientists' productivity. We doesn't have to forget that. And for example, according to UNESCO, female scientists in Europe and USA reported 5% larger decline in research time compared to the male colleagues. And we can go on and go on in studies done across the world. So what we have to do is to insist, okay, there is more. Me, I don't go to success that are so a little step in this long journey, and just attract the attention on the challenges, because we have made progress, but we have rolled back, and we can roll back even more because we don't know what tomorrow. So we need to be more bold and go faster, because the risk is there and we have seen it. So that's how I will do now, and give more opportunity to women to overcome the challenges they face. And we understand also that this is far more than what your institution can do for you, because when you are at home, it's not your institution who doesn't who go in the ear of your husband or your companion to say, don't wash the dish, let the kid cry, your wife is there. So it's a cultural revolution that we need to do more than ever. And changing the mindset, it's really clear. But also insist on all those inequalities that we are facing every day. We were talking, no, we were not talking, but there was a discussion before about pregnant women. Do you see that how late they got access to vaccination? Because the last to be tested is pregnant women. Pretexts, save the baby, they don't care. And even when they do research, they use the average person who tests the medicine is the young man, white. Men, because no menstruation, no pregnancy, so no problem. White, I don't know why. We should do anthropologic research for that. However, I'm a grandma. I'm an old Black woman. What do you think what suits that young white man can save my life or keep me healthy? So there is gender imbalance. There is, let's say, skin color imbalance, because I had to say race. We are one race across the world. Acknowledge that we are different race is fueling the racist theory. So there is a lot to do, and we need to advocate and make sure that the world remain unhappy with the status of the world.
So thank you, Lola, and yes, I could not agree more. We'd have a whole panel on issues around clinical trials and who is encouraged. So a couple of thoughts on this is, in statistics we talk about power, and power in statistics is exactly what you were talking about, which is the number of women that you have in a clinical trial to be able to determine, does this work in women? Is there any difference that's based on sex, that's based on gender? And I'm for purpose sort of disentangling those two things. But I think that we need to, so there is that statistical power, which we need. But I would say that is really reflects then more the research and the power of who gets to decide, who gets to fund, who gets to actually enroll, because it's a lot easier to enroll single men, particularly single men who have more economic resources, which in the US tends to be more white men, than the difficulties, quote unquote, of getting women, particularly women of reproductive age or even older individuals. So there is that power as well. And then there's also the power of who gets actually credit for what actually happens. And I think, going way back to the discovery of DNA, we have seen that the power of who actually gets credit and who gets to decide where the next steps in research is also. So I think all of those areas are areas in which we actually need to do more. I think in terms of the data, because what we measure matters, is also important. And I think there has been growing progress on the need to disaggregate data based on gender on a number of different things. And some of the work that Agnes and I've collaborated on, where we look at issues around gender equity, is really, really important. But I think that we often miss that when we think about the number of people that are entering into a career, the number of people that are entering at a university, and what actually happens over time. And while if you look at, for example, at my own institution, the number of women who are faculty has grown tremendously, we still have that same funnel that is happening that we see in many, many places. And there are definitely women who are emerging as leaders, and I think are coming at it with a different attitude about reaching behind and bringing up others, both the women as well as their allies, because we do need to promote and acknowledge and support our allies for this as well. So I think that we need the data really both at the beginning of this pathway, during the pathway, and at the end. And we need to understand why women fall off, because each woman that falls off should be viewed as a never event. Now, it could be that she's lost interest. Oh, I don't know why I went into medicine. That is not where I want to be. Or it could actually be that there are other reasons why she has done it in terms of balancing family and work, the environment in which she's working in, the pathway that she wants to take in research that doesn't seem to be open to her. So really understanding both our successes, but also our failures. And so rather than my traditional approach to data of the numbers, that we should think about this more as a mixed method study, to really understand sort of the how and the why of why women succeed, but also why it is that women are failing and how we can therefore make the changes. And sometimes it's just as simple. And I reflect back to the last time that we were all together at a conference, which was, I think, at the Women Leaders in Global Health in Kigali. And the discussion about how do we ensure that women who are on these really wonderful research capacity training grants, some of the D43s, for example, from Fogarty, are able to come over for 12 weeks. If they, for example, have young children and they don't have a husband who's able to actually take care, or they don't want to leave their children for 12 weeks. And how do you actually therefore create the kind of funding opportunities that, yes, it does cost more, but it's a good investment for the future.
Thank you both for your wisdom again and your inspiration. And of course, you have provoked questions in the chat amongst the audience. So Lisa, you actually alluded to a point that we should note again is around power. So one question in the chat says, let's discuss how women's philanthropy can help to support women in global leadership and how best to create a philanthropic community devoted to the mission and creating change for the greater good. So by former life in philanthropy, we know the role that foundations play in setting up the environments for success and promoting policies and practices that embed gender equity. So talk to me. I have comments, but I actually want to look to you all as also advisors in the philanthropic sector. What role can philanthropy play?
Not to mention recipients as well. So I think and again, I'm just sort of keeping an eye on the chat. So thank you, Judith, for talking about this. The fact that there's data and evidence. So some of it for me is like, how are you defining success? So if we simply define success as only the grants that people get, or the number of people that are impacted, as opposed to the quality and the equity of how that work is being done and who is doing that work and the effect of that work, I think that's going to be a big challenge. So I'm delighted that there actually are people who are looking at how do we actually understand where the investment is and how does this move forward? I think also recognizing that, if you sort of think about this as a socio-ecological model, it's not just about the individual woman, but very much about the environment. And there was just a very interesting paper that showed the importance of female empowerment as one of the most important factors for women for accessing care. And this is, again, something that we saw looking at exemplar countries and dropping under 5 mortality, that empowering the women, educating the women is a very important thing to do that. But again, I would say that we need to move beyond that important role of the policy and the education to, again, how do we then also create the leaders? And so I think that's a very important thing, because there's skill sets that are important for leadership that I don't think are traditionally taught in, for example, was certainly not taught to me in medical school. How to find your voice, how to address conflict, how to continue to advocate both for yourself as well as for the others that you are moving forward. So I am looking to learn from the women philanthropy to see how they are measuring it. I think it's absolutely critical to, again, it gets to this idea about power of who is deciding how, not just what kinds of announcements are made, calls for funding, but also who's judging them and how are they actually deciding on the criteria by which those are done. And having sat on a number of different grant reviewing committees, I would say that perhaps we need to continue that work.
And yes, any reactions?
You are on mute.
Sorry for that. So no, I totally agree. So that means what philanthropy can do, first, they could show example. I would like to go in the boards I would like to go in the chair of the committees and see the composition of those committees. And as Lisa said, you tend to choose people that look like you. Okay? So that means if you give a grant, you tend to trust people who look like you. So that means we have to fight all those bias. And that make that women receive less grants, a smaller grants, are published less when they are a first author. So there is a cultural deep bias. I think we should brainwash the entire planet to reach the place where we want to be, because this is so deep. Like, they did even in other place. They took they assess a musician with violin. When they see the people, women has always a couple of marks less than when it was blind. Not men. So it's beyond science. It's everywhere. There is a gender inequity, and probably because the model we got as leaders since we are kids ourselves is man-based. So we all have bias that we should fight, and that's why I insist that we say it and say it again without any mercy and any tolerance. So philanthropists, they give the example first, and after that they decide where go their money. They can give their money only when to NGOs or entities that are equitable in their leadership, but also in their staffing and also in their policies. I tell you, if the philanthropist world will do that, the world will be a better place to live within 10 years.
Thank you both, as always. So I'll close with one last question, and it speaks to, I think, some of my optimism and for the moment we have, and it's a question that's raised through the chat as well, about hope. What keeps you hopeful, and how are you supporting those that you are mentoring to endure? You know, we have a ways to go in all of our sectors. So how are you supporting that enduring spirit, and how are you maintaining that enduring spirit in your work?
Lisa, to you, you are the youngest.
That being a relative term, yes, but I'll take it. I think for me, it's the next generation. It is the women that I'm mentoring and that now are mentoring other women, and their optimism, and to some extent their absolute sense of privilege, no matter where they come from. Well, of course I should speak out. Of course I should decide what I want to do. And so for me, that is the hope. I think it is seeing very strong, really bright women who are including, and this has been brought up a couple of times, empathy and equity into what they are doing. So it is not just about getting the next grant. It's not just about doing the next research. It really is not giving up some of those core elements of who they are and what they are bringing, the strengths that they are bringing as women to their position. And again, whether it's in leadership, whether it's in research, et cetera. And so that makes me hopeful. And then again, you know, in the same way that I had a peer network when I was just starting, it's the peer network now. And so Agnes and I can't count the number of times that we are on calls where we have a separate WhatsApp discussion that is going, that is both to inspire, to support, and to essentially just vent about things that may be going on. So I think it's for me, it's both the people that I'm mentoring, some of who've become my peers, and then it's also the peer network. And again, really recognizing the critical importance of having that support, and that if you as a woman are not currently supporting both your peers as well as mentees, just sort of rethink where you're spending your time, where you're spending your effort. And again, including in there are the allies. You know, this is not something that we can do alone, and we should not be doing this alone, but really, again, continuing to involve, to educate, to train sometimes some of the men that I'm working with in terms of behavior on calls, engagement with younger individuals, some of the cultural changes, which I now feel empowered enough to speak about, but I certainly didn't, 20 years ago. So I think that's what gives me hope, is that despite all of these challenges, that people are talking about it, that people are not ashamed about it, and that there are people who are coming at this who are really showing the value of integrating some of these additional things that we've talked about. And I just want to sort of just highlight one of the things that came up in the chat, which is the social hierarchy of prestige and power, and where's parenting? And that to put parenting at the top, as opposed to, when I had sort of younger kids, which was one of the things that somebody taught me was, well, if you happen to be at the school play, but you can't tell anybody you're at the school play, take your calls from the faculty bathroom because there won't be any kids' voices there. So it was this total way of sort of hiding the fact that, oh, you happen to be a mother, as opposed to saying, when people are talking about their identity, that's something that they can not just value, but also that it's something that is appropriately understood, that it is appropriately, we always said, should people get extra, credit on grants, but other ways that we can understand the balance that people have, because that is our next hope, that our next generation. And as our departed friend Paul used to say, that's our retirement. That's our retirement plan. And we need to value that as well.
But I agree. And on top of that, I believe that we are better off today than 20 years ago. 20 years ago, when I was saying the same, even with more frustration, because now, at least when I'm talking, people listen. But when I was 40 years ago, I'm 68. So 40 years ago, when I was speaking, there was just say, oh, the problem was me. The problem was not what I was talking about. Now it's no longer the case. People agree that the problem is there, and that what I'm saying is right, even if they don't want to go for that, because it's a lot of work. Also, look, we have managed to create an institution in the north of Rwanda, in a rural area where students are happy and understand that it's a good thing that we take 70% of girls in medical education. Did you imagine that a couple of years ago? No. So those will be the ambassador and the agent of change that will multiply what we are doing today. I don't believe I will die before the world is gender equitable. I don't believe that, but I believe we have planted the seed for the trees we have and the flowers to flourish. And that's what gives me hope. Also, a good thing you can see, 20 years ago, try to find really data disaggregation, except to say that the problem of HIV is women or men who have sex with men. Now you have data disaggregation to understand the impact on women, even if the change is not yet there, but at least we have the tool. We have studied like we do with Lisa, when we show that when you are a poor woman, you have more chance to save the children. But with fact, before it was there, we know it, but it was to save the kid before 5, but after that, it's okay, it's growing up enough, the woman can go back to the cupboard. Now it's no longer the case. So we have hope, and that's good because I love to wake up in the morning and smile.
Oh, and you're my hope. So I want to just thank you both for your attention, your intention, and your action throughout your careers and advocating, championing women in this space where it's so important, and at a time well before it was popular. I appreciate you both for your time, and for those who are in the audience, thank you for joining us. Thank you for your attention. And also, I hope that you'll leave this conversation acting to support the leadership and professional development of women leaders in global health policy and research. So to that end, we want to wish you all a wonderful remainder of your day and look forward to standing in line together as we battle this this moment and rise to the occasion to what I hope is a beautiful new normal for the globe. So thank you all.
Thank you, Lola, for having us. It's really been a tremendous pleasure and honor.
It is a pleasure, it is an honor, and it's great to advance the agenda of gender equity. And things and meeting like this one are really essential piece of that. Thank you.
Thank you.
And hopefully next time in person.
Yes.
Yes. Okay, bye-bye and thank you.